Hello, sir. How are you?
Sure, good.
And what brings you here today, if you don't mind me asking?
Well, I work at the National Institutes of Health, and I'm a director of HIV/AIDS research at the National Institutes of Health for a particular institute that looks at alcohol and alcohol-related substance abuse.
Okay, and in your field, what is it that you specifically do?
Well, I direct the funding, the submission of applications in a wide range of areas, but we look primarily at alcohol-exposed individuals, who is about a third to a half of individuals with HIV have alcohol use disorders.
Okay, and why do you think that's kind of important, highlighting the research behind that?
Sure, they're both behavioral and biological issues, but the behavioral issues have to do with adherence to medications, but also mortality is related to alcohol use and HIV. The more you drink, the faster you die if you have HIV for various reasons. A lot of them have to do with organ and tissue injury and organ failure, neurocognitive impairment, and a number of other issues. But I think the most important thing is also that there are gender differences and exposure to violence among women as a result of partner alcohol consumption is the issue. And women are drinking more now, and they also have additional sort of comorbidities and complications in their lives.
And with that said, why do you think women are drinking more? Is that like a statistic right now, current study?
Well, I think we live in a very stressful society. Alcohol is readily available. It's easy to obtain. You can make it in your bathtub if you really want to. Unfortunately, we're here in Denver, the home of Coors Liquor, and the liquor industry is tied directly to the alcohol and tobacco industry, as well as the soft drink industry, as well as large-scale sports. Over $100 million was spent on alcohol advertisements during the Super Bowl. So obviously it's something, for some people it's fine, for others it's probably a problem.
And what do you think the 3 things that you're learning from this event that you're going to be able to maybe take forward with you into the community?
Well, I think that they actually are including substance use, alcohol and drug use in the context of opportunistic infections, HIV and COVID. So where this meeting was primarily focused on virology and vaccine development and largely trying to eliminate HIV, I think they're acknowledging the populations that are important to address that have substance use, mental health problems. And there are also individuals that are growing older with HIV, and even though they may or may not be effectively treated, they still have a lot of residual problems that are related to other lifestyle factors. And also it's a minoritized population now that we need to address, which is largely the group that's bearing the largest impact of HIV and poor treatment outcomes.
Is that kind of a discussion as well, how to help the poor basically with those treatments?
Well, you're trying to help a whole group of people that don't access care, and it's largely a function of the medical system in the United States and how we've created the opportunity for carrying complex comorbidities as people age. So you have many other things like diabetes, organ and tissue cardiovascular, liver failure, but a lot of them are mental health, dementia, stroke, and other things that are occurring in the older population, but also how do we provide care for them, like assisted living, and deal with a lot of the emerging problems in specific subpopulations.
Are there anything that maybe some things that you think could help that?
Oh, absolutely. I think the primary thing is look at the things that we can change in people's lives. They may or may not be willing to change them, but probably the most effective would be to get them to reduce their drinking. And primarily because it interacts with all of their medications, it shortens their lives. It's it's related to very high-risk situations that people encounter. Virtually the lack of use of PrEP, which is essentially a preventative measure for HIV/AIDS. So unfortunately, it's a population that's highly intransigent, and it really represents about the third highest level of problems across the population, both domestically and internationally. Alcohol.
Yeah.
And unfortunately, the alcohol and tobacco industries are the most powerful industries that exist at this point and have the most money, and and they have to, even though they put something on the bottom of their drink saying drink responsibly, they don't quite tell you how. And I think it's a particular issue for gay men and gay bars, and how they've perceived their own risk and how to modify that.
Do you mind me asking, any research done with medical marijuana and alcoholism?
Well, sure. Well, don't use the term alcoholism.
Okay.
It's alcohol use disorder. It's largely a continuum now. We don't really think about people as alcoholics anymore. What we think about is the pattern of alcohol use that people engage in, and when it places them at risk for various different outcomes. But we also look at cannabis and cannabis policies, and actually the access to cannabis has increased the rate of alcohol use rather than reduced it.
Okay.
So what people had thought was that people would substitute cannabis for alcohol, but the problem is, alcohol is often consumed for depression, anxiety, pain, trauma, sexual trauma. For tobacco use, there's essentially a biological reason why these are paired together. So cannabis has largely probably increased the rate of cannabis. Cannabis use has increased the rate of alcohol use.
Okay.
And I don't know this for a fact, but I would assume that the large alcohol industry is investing heavily in the cannabis industry because they know there's a linkage. And they've also invested in largely the soft drink industry because they know that stimulants, particularly caffeine and nicotine, will also increase the rate of adolescents and young adults engaging in alcohol use.
Sure. For instance, in North America, the healthcare is actually funded by those companies, the nicotine companies and the big sugar companies.
Well, they partially fund them. Again, you have a very complex patchwork quilt of funding for healthcare, and much like with the cigarette industry, you're going to have to identify where the problems are and get some financial support from them for the potential consequences related to cigarette smoking, which are, of course, we know they're related to cancer and many poor outcomes.
Sure.
So,
do you think that maybe that could help our country, is maybe those big, corporations, what they do in North America with helping with the health insurance, fund it, maybe that could help the solution here?
Well, I think there needs to be government involvement in identifying the impact of the outcomes and their costs. And there are ways of doing this. There are health economists that look at, they're called QALYs and DALYs, but years of life lost. But we know on the average, the years of life lost for people who drink are about 6 years. And obviously for other people where there's toxicity and eventually death related to either combinations of alcohol and other things. It's much more than that. So, and cigarettes are similar. Again, who should pay for the car accidents? 50% of emergency room visits are alcohol related. So who should pay for those emergency room visits?
Sure, that's kind of an interesting subject too, because all these bars have parking lots, you know, right there.
Well, you have legal methods of creating, you know, essentially drunk driving laws, but then you offer palliative measures like getting free rides home. You know, it used to be you got on your horse and the horse would take you home. Now I'm sure that Tesla should have a special button that if you're drunk, you push and it takes you home.
Yeah.
Should have a little horse on it.
Right, because you can't be drunk on your horse here. You'll get a DUI here in Colorado.
Right. So, but again, you know, it's not, you know, it's something that's manageable. There's harm reduction. There are people that have changed their drinking patterns, and we have effective interventions for this. So, unfortunately, we all like to drink, or many of us like to drink, and we enjoy the social situations that are related to those. But they can certainly get out of hand fairly quickly.
Sure. If you don't mind me asking, something that you're learning or talking about amongst the colleagues that you look forward to bringing back to your community.
Well, I think what we're going to say is that this conference, which is primarily biomedical, has acknowledged the importance of other individual level factors and health disparities and the populations they affect, which I think is critical. So, and particularly clinical outcomes and managing those in an aging population. So I think that's very important. I think what you had were a fairly large number of biomedical scientists doing excellent work that was heavily funded by a variety of institutes, the National Institutes of Health, and other places, but they don't really address community needs or specific subpopulations that are important. So I think it's acknowledging that they're doing this and sort of getting, it's sort of getting on the map of the biomedical researchers.
Sure. Is there anybody that you might want to mention
Sure.
to look into?
Tony Fauci. Hi there.
Okay. Fantastic.
I worked with him maybe 30 years ago, but I'm glad that he came up with, or not him, but his institute, National Institute on Allergy and Infectious Diseases, has actually came up with treatment or intervention for COVID. We certainly hope they come up with something for HIV. It's been in the making for over 20 years, and hopefully there is some successful vaccine or cure. But you've promised it every few years, not you, but now the person who's the head of NIAID, and we wish you all the best luck. But until then, we really need to address the subpopulations that are at highest risk and are continuing to become infected.
And what do you think is one factor really sticking out that you think should maybe really be discussed?
Well, I think we need to pay more attention to international work. I think the United States has a huge number of resources, and even though they have fragmented healthcare systems, they've enacted things like Ryan White and a number of policies that have actually led to fairly effective control among the individuals who are willing to, you know, identify themselves with problems and get the appropriate treatment or therapies. But I think there's still a population that sort of slipped away or slipped between the cracks for whatever reason that we need to still pay attention to. And unfortunately, I think there are differences, large differences in the types of administration and support for both research and implementation of these types of interventions that we should support and pay attention to.
Are we at all considering that? Is that being discussed amongst you guys?
We're not allowed to discuss it, really.
Sure.
This is Super Tuesday.
Gotcha.
But I think the issue is the federal government has a major role in terms of the health of the broader population as a whole. And we shouldn't, I've seen other countries where if you can pay for treatment, you get it. So if you're an oligarch in Russia, you can get perfect treatment. But if you're an impoverished individual, you basically get very minimal intervention.
Sure. Well, I can't thank you enough for your
Sure.
time. Thank you so much, sir.
Well, I hope that it's of some benefit, and I like journalists. It's very hard